We want to turn now to Dr. Richard Besser, who led the CDC's effort against the H1N1 pandemic. He's also the president of the Robert Wood Johnson Foundation. Dr. Besser, good morning. Let's go back to the vaccine, because it's all but official now that it will be approved by FDA based on what Tom Costello just reported. Did that panel hearing play out more or less as you expected? Any surprises, any concerns?
It did play out as I'd hoped. I was able to watch several hours of that, in particular the discussion. And it was a frank and open scientific discussion. There was disagreement among members of the committee. They were asking challenging questions, in particular questions around safety and what studies might need to be done that they would recommend after an EUA is issued. So an EUA is a starting point. It says you can move forward, you can start to vaccinate people. But in all likelihood, FDA will request that the company continue to do additional studies. There were some questions about whether there were enough participants who were in the 16 to 18-year range to approve it for that group. But there was an overwhelming feeling that this is a very safe and effective vaccine and that the FDA should approve it.
Well, it certainly exceeded, I think, most researchers, most scientists' dreams in terms of how effective, when you're talking about 90%, 95% effective. So that's the top line, safe and effective. But there's still a lot we don't know about this vaccine.
Oh, yeah. We've never had a vaccine approved this quickly, and that will raise a lot of concerns for many people. And those concerns have to be addressed. You're not going to be able to address those concerns by just putting out ads saying everyone should get this vaccine. It's going to take federal dollars so that communities and states can work with everybody to understand what are people's concerns, who are the trusted leaders in each community, what is it that needs to be done to ensure that as this goes forward, they're continuing to collect safety data. This is being approved based on 2 months of safety data, which isn't a lot. And as we already saw in the UK, they were detecting issues in people who have severe allergies. So everyone's going to want to be certain that as it goes forward, they're not stopping looking. They're continuing to study this so that if there are longer-term problems, they'll be detected.
And let's just spend a moment on logistics. When I think about the task of trying to inoculate 200 million Americans or more, at the very least, with a shot that requires 2 doses over a period of weeks. I mean, it's hard to even fathom how they're going to pull this off. How confident are you that we're going to be able to get this done?
Well, I'm confident we'll get it done. I'm also pretty certain there are going to be a lot of speed bumps along the way. And so there has to be transparency around that. People have to understand how challenging this is. I serve on the 7-state regional commission for the Northeast, and in our call yesterday, states were talking about how challenging this is. As a general pediatrician, I'm used to vaccines coming to me so that I could give them to the kids in my clinic. Here, with these requirements of such cold temperatures, it's really going to be an effort of getting people to where the vaccines are. And in rural communities and communities where transportation is an issue, these are logistical issues that the local health departments and governments are going to have to address.
Well, to be continued. We'll be watching this unfold. Dr. Besser, as always, thanks for your time.
It's a pleasure.